Hi, my name is Chuck Socia. I'm a imaging informatics professional. I started working in this profession almost 25 years ago. We started working in the computer world, trying to figure out ways to put images onto a computer, trying to make things better. And what we've learned, what we came through in this process, is we've developed a better way of delivering healthcare. And what we're looking at as SIIM into the future is ways that we can move into a process to use that expertise, the trials and issues that we went through over the past 10 to 15 years of this profession, building that into something that can be used across the enterprise. We're looking for ways to use the skills that the CIIP and the professionals that have developed over the past 10 years into processes that can be used across the enterprise for the image visible light, the cardiology realm, the pathology realm, all of those areas where we have in the past run into issues that are now going through the same things that we've run into over the past 10 years. We already know how to solve those issues. When we started 10 years ago, we didn't know the simple things about how to move large files from one place to another. Some of the other divisions within the hospital are now running into those same issues, but we in radiology and in imaging informatics have already solved those problems. Moving that process that is currently the CIIP into a process that is informatics across the enterprise. Using those things that we learn, building on it, and showing us a solution that we can live on into the next generation of informatics. And over the past 10 years, we've learned some things. In our practice, one of the things that I do on a day-to-day basis is I implement software systems. And what we've learned through the process of developing our old PACS administrators is that there are certain skill sets that are needed that are universal skill sets. Those include things like education, ability to communicate, the ability to handle contracts and negotiations. Those things that we talked about as a specific imaging domain, we're now seeing that that process and those things actually happen outside of imaging. And there's a level of expertise, a missing piece in medicine in general, that uses technology to achieve the goals in a more efficient and a more productive way versus what we did years ago. The old days of keeping a logbook of what processes we do on a day-to-day basis are now gone. There's technology solutions that make that simpler, more efficient, and more cost-effective. There are still places within the hospital, within the enterprise, that are still sticking to those old processes. They're still trying to find a way to take the paper logbook and turn it into a process that can be efficient and cost-effective as we reduce the amount of income that hospitals have, the working capital they have to work with. You've also got to find ways to still complete the job that needs to be done with fewer resources and less money. And the solution, the way we can do that, is with technology. The imaging process went for years ago where we started doing 5 CTs a day, and that was a full day's worth of work. And we're now able to take a radiologist using the technologies that we've developed through SIIM and through the expertise of the CIIP. We've developed ways to handle many thousands of times exponentially what it is that we can do on a day-to-day basis, because we've built the tools to handle information. And information across the enterprise is where we're looking to go to be able to handle those same type of problems that are happening universally throughout the hospitals.